My name is Ernie Fabian. I've lived in Humboldt County for 42 years. Enjoyed the fog and the wonderful weather up here. My situation was I was a reentry patient. 17 years ago, I had a triple bypass. In the last 5 years, I was experiencing some difficulty with my heart valve. I had to find a surgeon or a surgical group that could reopen my chest again and get to where the heart valve had to be replaced. And that was the challenge. And when I went to see Dr. Michaels here, he was the one that knew where to start. He sent me down to Santa Rosa to meet Dr. Deek. And there, after examining some of the tests and the angiogram, he said it was the worst heart valve he had ever seen. I knew I had the condition. I knew something had to be done about it. A little ray of hope came into the picture where Dr. Deek told me I was possibly a candidate for a TAVR.
Mr. Fabian is a delightful man and willing to listen to whatever we tell him in order to get better. What made Mr. Fabian a good candidate for this procedure is the fact that he had already a bypass surgery with open heart surgery, which means that he has extra scar tissue around his heart, which made him at a higher risk for aortic valve replacement.
When I first met Ernie, I was amazed at how young he looked. We all recognized that a second open heart procedure to surgically replace the valve would be risky in him simply because of the first procedure already been done. This is exactly who the procedure is made for. TAVRs really become state-of-the-art and the go-to procedure for aortic valve stenosis. Previously, the only option was surgical aortic valve replacement, which is still a very good procedure for the right patient. But there's many patients who are elderly, they have other medical problems that increase their risk for surgery. This is a procedure that allows us to replace the valve without opening the chest, without changing the chest mechanics, and through two tiny incisions in the artery rather than a large incision in the chest.
This was an alternative possibility to having your heart valve replaced as opposed to open heart surgery again. So that right there was my ray of hope. That right there. I had no worry whatsoever. These were experienced surgeons. After looking at all of my test results and everything, I went through a lot of questioning about my history, and so I felt I was in very good hands with everybody, including the nurses, the technicians, and the other doctors involved in the process the whole time.
They're able to go home the next day, and once they go home, they actually don't have any limitations. They can drive, they can go back to their daily routines without any limitations. What makes this program remarkable is the fact that we have different teams coming together: cardiologists, cardiac surgeons, operating room nurses and staff, cath lab nursing and staff, and bringing in their expertise, their knowledge, and putting it together into one arena and customize the treatment plan based on what they need. We've been very successful in attracting extremely talented physicians to provide that care.
I was treated very, very well. I think the best experience is walking down the halls and people knowing who I was. The biggest pleasure to me, having had this procedure done, was be able to get on my bicycle. It's a whole different feeling. I can breathe. That's what I can do. To get up and be able to do, I can do that chore again. I'm not going to stop and take a breath, pace myself. I have now the luxury of the freedom just to move about and breathe freely.
The reason why I went into surgery is to be able to mechanically help people get over their problem or their disease and see the immediate results of that intervention. And the TAVR procedure actually provides that type of outcome to these patients.